Thank you, Oma. And we really do appreciate your participation and sharing your insights and questions as we move through. We'd like to start with one poll to begin before the presentations. And that is going to come up now, I think. Okay, so how long have you been involved with HIA or HiAP field? Please select one option and we'll give you just a minute or two to respond.
Can everyone see that result? Looks like half the respondents have been doing HIA HiAP field work for less than 1 year. So that seems to be the majority of our participants.
Yeah, very good, thank you. Okay, I'd like to turn it over then first to Dr. Sandra Whitehead. She will kick off our presentations, and thank you for being with us today.
Thank you so much, Dr. Stone. I'm going to share my screen. Can you see the slides now?
Yes, we can, thank you.
Yeah.
Great. Thank you. So thank you so much for kicking us off, Cindy. As Cindy said, I am Sandra Whitehead. I am the current president of SOPHIA. We have recently rebranded ourselves to use the entire acronym SOPHIA, the community of HiAP professionals. A little bit about SOPHIA. We are an association of individuals and organizations that promote the excellence in the field of HIA and HiAP, and we work to provide resources and build capacity of folks to practice these areas. You can join us at hiasociety.org, and there'll be an opportunity at the end again, in case you don't have time to write that down. So I'm going to provide a little bit of context. I'm not going to spend a lot of time on it because I want to get to the panel discussion. But especially since so many of our participants are new to the field, I want to give a little bit of background of why HIA and HiAP work is important. There's so many things that impact health that are outside the control of the public health department or even of public health practitioners. And so using a social determinants of health framework, this idea that we can influence other sectors, right, to help promote health and safety, to provide opportunities through policy work to impact health and equity and address disparity. And using this health in all policies approach or framework gives you the opportunity to really systematically take into account health decisions and implications, to build partnerships that create synergies and efficiencies across departments. So if more than one department touches an issue like housing, whenever you work together, you can each bring new resources, and that creates efficiencies. You also deduplicate whenever you are working together with health in mind on these other kinds of issues. The other thing about a health and all policies approach is that it allows you to avoid harmful impacts. It's very forward looking, and it is really preventative. You're really taking the precautionary principle and applying it to policy work. The other thing that's really useful about a health and all policies frame is that it is addressing population health and health equity. And this is the definition from the World Health Organization that most organizations in the United States use to think about how they would approach these outside issues that impact health. How would you think about walkability, for instance? The health department doesn't have the ability to build sidewalks or even to fund those kinds of infrastructure improvements, but the health department can work with their planners and their public works departments to put health into that prioritization of sidewalks. And there are 7 strategies that are widely accepted for implementing health in all policies. And I'm not going to go over all of these strategies, but the biggest one I would say that most people are working towards and began health in all policies doing is this idea of incorporating health into decision-making processes as a default. This is what I consider the ultimate, the holy grail of health in all policies work, where people in other departments besides the health department are thinking about health outcomes as part of their everyday work. They understand that what they're doing in public works or the Parks and Recreation Department, or even in health and in finance, what they're doing influences health, and they are working with as a team to do that. And so thinking about health in all policies as this framework, one of the tools of health in all policies, one of the ways that health in all policies is implemented is health impact assessment. This is really a process that looks at individual programs, plans, policies, and projects before they're implemented, and uses a 6-phase process to assess and make recommendations for addressing health impacts that would be caused by this particular decision. So as I mentioned, it's a 6-phase process, and it's really community driven, less like a regular health assessment involves the community, but this is very much investing in making sure that the people who are impacted by these decisions, which is part of what you're deciding in the HIA scoping process, who is impacted, what severity are they going to be impacted, what is the likelihood that they're going to be impacted, and for how long. Right, so HIA is assessing that and then working with the community to not just communicate those risks, but to say which of those are the most important to work with the community to co-create recommendations that will address their concerns and ameliorate health impacts that are unavoidable, and to emphasize positive health impacts, right? It doesn't just look at negative impacts. It also looks at positive impacts. And how do we maximize those? So health impact assessment is really this tool that promotes democracy by making sure that the people who are impacted by decisions are participating in the solutions. Equity by making sure that disproportionate and disparate impacts are addressed. And it really is lifting up this value as health as important to everyone and should be accessible to everyone. This is the 6-phase process that I mentioned. Your screening and scoping is really whenever you're deciding, is it feasible to do an HIA? Do you have enough resources? What is the real question that you're asking? Who are the impacted populations? What are the possible health impacts? And what are the parameters of the HIA? Once you have those decisions made and you've worked with your community to make sure that the scope addresses their concerns and their priorities, Then you move to your assessment phase. And in your assessment phase, you're looking at community narrative and integrating that with quantitative and other kinds of qualitative data that you're gathering on the impacts. And you're really assessing what are what are the things that can be changed, what are the things that can be addressed, and working with the community to make those recommendations. So, and then in reporting is where those recommendations come together and they're reported not just back to the community, but to the people who are making the decisions. And then evaluation, you are evaluating your process, any outcomes that you're able to evaluate at that point in time, and you're making a plan for monitoring outcomes over a space of time. So looking to see what health impacts came true, which ones were effective, and in your monitoring plan, you're really making a plan to go back and revisit that in 3 to 5 years. So that's kind of the setup for HIA and HIA work. And now I'm going to transition and talk about how I came to HIA and HiAP work. This panel is really trying to reach out to people who might be new practitioners like many of you, or who are interested in this work and aren't sure if they have the skill sets or the right kinds of experience to bring to this work, or what skill gaps they might need to address. So part of what we're going to do is the three of us are going to talk about our career journey, how we came to do this work, why it's important to us, and sort of give you this overview of what we think you would need to know to do this work. So my background is that when I was in graduate school in Florida, in Tallahassee. I got a job at working in local government. And my very first job in local government was in a budget office where I had to look at how do we spend our resources as a local government? And that really made me think about how do we prioritize policies? And so as I finished up my PhD in public administration, I started working for local government as a planner, and I worked on long range policies. How do we design our built environment to encourage community health, to make sure that we're growing smart, to make sure that everyone has chances to be successful in our community. And, this is where I learned the philosophy for if we are planning for people with the fewest choices, then we're taking care of everybody. And I worked as a local planner in various very small communities in Florida for the first 20 years of my career. And then I made a switch. I went to work for the Florida Department of Health. And this is really where I put all of those sort of ideas that I had about sustainability and making sure that people's health is being taken care of through the policies that we can do as planners, and how we design our communities is important. Well, there was a visionary at the Florida Department of Health named Daniel Parker, who said we really in the state level need to address our built environment. Sprawl is destroying Florida and it's killing people here. How do we as a state health department address this? And so we work with each of our 67 county health departments to work through different tools that we could use, how to create relationships with our planners. And HIA was one of the tools. And I taught it to every single person who worked at the Florida Department of Health in environmental health over the space of 5 years. We did 12 HIAs in 5 years. We really built a community of practice there. We went to the Southeastern HIA conference when it used to be a thing that happened, and really were able to make the move from just doing HIAs to taking this health and all policies approach at a statewide level. And we built it into the state health improvement plan as a thing that county health departments have to do. And that's morphed now into their health equity plans. But this was when I really began doing HIA. And over the years, as a state employee, the pay is not as great, but people started seeking me out to help them figure out how to do HIAs in their community. And I started doing this as a consulting business and really working in health and all policies as well. And I came to DC to work with 2 national nonprofits doing a lot of the same kind of work, working with health departments and communities all over the United States and overseas. And in the last 6 years, I've been a member of the National Environmental Justice Advisory Committee. And part of my work there has been to advocate for HIAs and HiAP approaches in environmental regulatory work. And part of that work has been to use this, to bring this health impact assessment lens to cumulative impact assessment work that the EPA is doing. And like Cindy, I also teach HIA at George Washington University. So this is kind of how I have gotten to this work. These are just like some of the things I described that I did on my way here. And it's my privilege also to be the president of SOPHIA and, to really get to work with people who do this work every day. And these are some of the job titles that our members have. I kind of went into the membership database and I pulled out some of the job titles that members have. You can see there's a wide variety of things. You really need all of these skills that are listed here, right? You need an epidemiology person on your team. You need someone who can do research. You need someone who can work with the community, right? All of these job titles reflect skills that you need to do this work. And I kept thinking, what exactly do you need to what kind of people do you need on your team, right? Because no one person is going to have all of these skills, right? You need someone who can do this research, to be able to read the literature and integrate things like legislation and testimony and understand how to develop and determine baseline conditions, how to figure out impact, likelihood, and distribution, right? You need someone with that research bent. You also need someone who can work with the community, someone who's culturally competent, someone who already who knows how to build and keep community trust, someone who knows how to communicate complex ideas in an easily accessible way, and someone who can work with communities to bring forth their ideas and lift them up without co-opting them. Right? Those are very specialized skills. And then you also need someone who can do this leadership function of partnership formation, right? Reaching out and creating a situation where partners come to the table because they see value and they're getting something out of it. And that's a real skill, to create those win-win propositions. So it's very important in this kind of work. I mentioned being able to listen to and integrate community narrative, but also to be able to validate community narrative as evidence. This is something that's been a real challenge for HIA practitioners over the years, and it's something that I don't think is taught very well, especially in college. And then evaluation. As you're going through your process, you should be evaluating what kind of a job you're doing. Have you reached the right people? Has everyone been at the table that needed to be at the table? How do you improve your process while you're doing it, instead of waiting until the end and saying, oh, we could have done this better, or we could have done that better. These are the things that I think you really need to be able to do this work, skills that I think you have to bring to the table. And now I'm going to stop sharing and I'm going to turn it over to our next speaker. We're so thrilled to have Julia Kaplan join us. Julia.
Thank you, Sandra. It's really a pleasure to be here and to be here with all of you. And so first off, I just wanted to note, it was great to see that survey at the beginning about the number of years that folks have had in the field. And I saw a lot I think there were a lot that were like 1 year or under 1 year. So that's awesome. And I am curious, but I don't actually know from that if that means that a lot of you all on the call are early career, or if it means that you're like far into your career and you're looking to make changes. So I'm curious about that. And if anybody wants to say anything more in the chat about where you are and kind of interests, I'm sure that would be useful for all of us panelists. And I'll take a look at that as I'm making remarks and thinking about like what's a good fit for where you are. So I'll just a little bit about myself. I'm the executive director of a small nonprofit called State of Equity. We're actually part of the large nonprofit Public Health Institute. And we recently rebranded to State of Equity. We used to be called Health in All Policies. And we were formed 13 years ago because the state of California established a Health in All Policies task force and then needed a staff team to staff it up. And the state government didn't have the resources for it, but there were community activists, organizers, community-based organizations that were really committed to seeing this succeed. And they worked with philanthropy to get some foundations to put up the resources to establish a staff team to be able to support this work to happen. So it was like community organized to transform government. Community got government to establish this Health in All Policies initiative, and then got philanthropy to provide staff, and then we got government to let us staff the work for them and in partnership with them. And then over the course of about a decade, we did a lot of work to demonstrate that this was a successful approach and get government to ultimately build it into their own budget and staff the work up. And so I've been on that team since 2010. And that's just a little bit about kind of how I come to this field. Just looking in the chat, I see some early career, MPH grad student, working in health equity for a few years, but just starting to learn about HIA and HIAP, further along in my career, educating state and communities on HIA and community engagement. So I wouldn't be surprised if at the end of this presentation, if we asked you that question again, you might add years to your level of experience, because very few people actually have HIAP or HIA in their job title or even their job description, but end up doing this work. And you might actually come away from this being like, oh, I am a practitioner. So I encourage you, this is one of those things where you get to claim it if it feels like a fit for you. A little bit more about myself and my career journey is I've been a social justice person and organizer my whole life, going back to, I have very early childhood memories of seeing things around me where it was clear that there were injustices, and in that way that all of us were as children, when we saw things that weren't right, we were shocked and dismayed and horrified and expected people to do something and to make a difference. And like many other people, I had those experiences and was really disappointed and devastated at the lack of action from the adults around me. And I had some experiences as a child internationally where I saw really abject poverty, and I saw the impacts of global colonialism and racism and health inequities way before I had the language for that. But I knew that there were things that were happening that were wrong, and I knew that there was complacency, and I made a commitment to myself as a very young person that I would not be complacent and that I would strive to make a difference. And as I grew older, I came to understand that so much of this was impacted by government. And you know, Sandra talked about both the importance of working with government to avoid harms, but also really like protecting and advancing democracy, right? Like, who is government for? Why do we have government? And the more deeper that I've gotten into health and all policies work, the more I've learned about the harms that government has caused and the way that government has been captured by interests and by groups that want to perpetuate inequities and injustices and want to see resources be distributed unequally and want to keep some people down so that those special groups can be up on top. And I made a commitment many years ago, and part of why I went into public health was the public part of it. That I wanted to see our systems truly be systems for justice and for democracy and for humanity. And as I've been doing health and all policies work and working on many of the areas that Sandra talked about around transportation and land use planning and housing and a lot of stuff around built environment, as well as social services and parks and education and you name it, working with these government agencies, it's become clear to me that institutional and structural racism are really at the core of the problems that we're seeing and the systems that we want to change. And so my work, and I will say, I don't do health impact assessment, HIA. I have never done one. I've been on an advisory committee for a couple of them, so I've learned about them. But my focus is really much more on the politics side of how do we get government institutions to change and to rewrite their mission statements so that their mission statements are about well-being and justice. How do we get them to change their budgets? How do we get them to change who they appoint and who's in leadership so that we're not having to bridge between government and community, but the government is actually made up of community. Like, what would it look like to get there? And so I'm focused more on kind of the politics and the normalizing of these concepts and how do we get government entities to collaborate with each other and really make these changes, working with folks on the inside of government to make changes, because government is filled with amazing people who want to see things be different, and also working with those folks on the outside of government who are really, really essential to this work, both as thought partners, as subject matter experts, but also as kind of agitators and folks to put pressure on from the outside. And it is through those kinds of that kind of work on the inside and outside that we can have opportunities to do things like apply a health equity lens, do health impact assessments, and have those not just be a research project, but be a research project that then guides policy and decision-making and changes the practices of institutions. So that's a bit about kind of how I approach the work. And I was a social justice activist in high school. I was involved in immigrant rights organizing. I will say I'm white. I grew up in a multiracial family, very committed to ending racism. And when I was in college, I was involved in Israel-Palestine organizing, and actually thought that my life was going to be doing peace activism in the Middle East. And then through some, different opportunities come up and things like that, I ended up doing youth organizing in Oakland, California, where I live. I live on Chochenyo Ohlone, unceded territory, also known as Oakland. And I was organizing teenagers and doing leadership training with teenagers around schools, not jails. And, again, a focus on our government institutions and injustices, and why was our government putting more money into incarcerating teenagers than it was into educating teenagers and providing opportunity? Like, what's wrong with this picture? I went on from that work to do reproductive rights work, again, doing leadership development with medical students who were trying to change the curriculum so that they learned about abortion and about contraception. And eventually I went to graduate school, and I studied public health and public policy. And I went to graduate school for a variety of reasons, but it was hard to choose what program to go into. And I was like, what's the social justice focus. And so I learned about public health and really found a home there, as well as policy, and it was great to be able to be at those intersections. One of the questions I was asked to respond to is about skill sets. And so I think it's great, like you have a real variety between Sandra and me and Tatiana in terms of like where we plug in, because there's so many different types of careers and work opportunities that intersect with this field. I will speak to my own, which is really, as I said, around the politics and the political will and how do we change minds and hearts, but also systems. I will say that it's critical to be really clearly values driven. This probably applies to anything, even if you're going into really like detailed research and analysis, but be clear on your values. Take the time, to really know yourself and have a big vision. Talk about it, get good at talking about it, telling people what your vision is. I think whatever, we are all called upon to lead in this work wherever you are and whatever level you are. And that's one of the biggest ways, is by holding out the vision and reminding ourselves and the people that we work with what it is that we're trying to achieve and where we're going. I think it's great if you are in school or going to school to learn about policy areas that are not your own. So if you're studying public health, take a class in social welfare or public policy or law or land use planning or energy, or, just like having that generalist approach, I think is really useful, because one of the hallmarks of this work is the intersections between policy areas. And even knowing a little bit about a lot of different policy areas can be very helpful. I think having skills around convening, facilitation, relational pieces. So even if you've done work that you don't consider health related, but you've had a role as an educator, as a facilitator, meeting planning, how do you plan good agendas? It's critical. You get an opportunity to get 10 people in the same room, or even 3 people, and it was hard to get time on their agenda, and you've got to prove to them that you're going to use their time well and help them see that they want to stay working with you. You'd better develop an agenda that's going to be really inclusive and engaging and thoughtful. I spend more time planning meeting agendas than I do in the meetings themselves. And that's something that I've learned over the course of this work, but like seriously, get good at planning agendas and planning meetings in addition to the facilitation. Yeah, so those are a few of the pieces, and I will stop there. I think I'm passing it over to Tatiana, and just really happy to be here.
Yeah, thank you both to you and Sandra. So inspirational. Before I go in, I just want to pause for a minute and see if there are any questions anybody wants to unmute and ask as well. Reflection on anything that Sandra said or Julia said in their kind of career path, or HIA, HIP specifically.
All right,
Right.
not seeing any. You want to go ahead, then you want to share your own slides?
Okay, sounds good. Well, thank you for the opportunity. I'm excited to kind of share my journey to health policies and health impact assessments, and kind of how I took that. I think as Julia noted, had a little bit, different track to that. I'm originally from Russia, and I went to law school there, and I was very convinced that, and believed in the strength of laws and the importance of laws and legal systems, and really wanted to become a lawyer. And so I kind of started my track there. That was my introduction to legal systems. And as I was doing this work, I started recognizing that the ways that laws can play out and the way that policy spaces play out can have different impacts on the communities and how they get implemented. And there might be some those who are affected negatively by the implementation of the laws. So that kind of led me to be really interested in engaging on the ground and doing some work with human rights organizations. At that time, particularly, I got involved with some organizations, youth organizations in Croatia, Zagreb, really learning what their issues are and how they tackling that. So that really enriched my experience and again, helped me to understand how the laws do play out. So then after I graduated from law school, I wanted to understand more about how policies are made and what's the politics around, making policies, how all this come to fruition. And so I came to the United States and continued my kind of graduate studies in political science. That got me a good introduction to kind of, policy theory, started learning a bit more about kind of civic engagement. And again, I continued to think about the questions of how do it get implemented in reality and what are the implications on communities. I did have, aspirations to continue helping, I think, at the state or even national level to create holistic, well-intentioned policies. And so with that trajectory, I joined Legislative Research Department here in Topeka, Kansas. And that was a great introduction to that state level policymaking process. I was able through that to really understand kind of the mechanisms of how policies are made, the purpose of kind of testimony, all the different, power dynamics, and again, identify where are some gaps, where are some limitations, and how can we, different organizations have this entry points into policymaking process? How do we inform policies? I also recognize that in the policies discussion, health and health considerations are not always a part of that, or actually in a lot of cases, they're not a part of that. As being at the Legislative Research Department, I was staffing committees on federal and health affairs and kind of government efficiencies, and seeing through that process and discussions, that kind of health were not a part of this. And that made me curious because thinking again about the implication of policies. So that work really led me to, as a part of the journey, I had an opportunity to be part of the health committees, so working on the Senate side and health, human services side. And I got really interested in kind of public health, population health work. That led me to the Kansas Health Institute, where I've been kind of on 15-year tenure here at the Institute in different roles. And because of kind of that policy and legal background and my interest in understanding how can we make laws, policies, consider health and equity, really led me to try to understand more about how health policies work and health impact assessments. And I was very fortunate actually to learn both from Sandra and Julia and Cindy Stone, who's in the work, they were doing some great work in that space and health policies in other parts of the country. And I was really learning what that can look like and what that can look like of implementing that in a state like Kansas. So that led me to start some work at the Kansas Health Institute specific to health and policies, because before that, we haven't had that work yet. And that was in 2010. And so some of the reflections already mentioned, but that through my career, I had some specific reflections on that policymaking process can be tough to navigate. And so what does it look like at the local and state and county level? How can different organizations enter that policymaking process and provide their information? What are some ways to do that? It also let me, understand that policies can exacerbate health inequities. And so really seeing again the value of tools that have been discussed today, how those tools can really inform those processes. that there should be that implementation of health equity lens. And, Julie spent some time talking about that social justice, health equity lens, that will be very important in that process. And as I was presenting some of the information to the legislature and to the decision makers and working with communities, I began to really realizing that needs to be that capacity building at all levels to really help all the parties to connect the dots between decisions and the impacts of health inequity. And so how can that really be done? So as I was continuing this journey, I also been influenced by some personal experience of experiencing how our environments can, really impact our health. This is the picture of the childcare facility. So I had at that point when I was started doing this career on health policies, a 4-year-old, or actually, he was, I think, 2-year-old at the time, to put him in the childcare. And I was looking, and we had at that time, some budgetary constraints. So we had to be very mindful how much we can spend on the childcare. And so as a result, I picked that one, and what the arrow is pointing to, the playground. And so when I came to the childcare, I was really very surprised to find out that the playground was facing the road. And I was like, wow, how is it possible? Because you have all this, emissions, and the children are going to play outside. My child is going to be outside. And I was really surprised. Why wouldn't there be, through policy or something, or zoning restrictions, not to do that? And because we have budget constraints, so thinking about that kind of the people with certain, socioeconomic constraints don't have a choice. They have to go where the budget allows them. So we had to put at that time our child in that particular childcare. And it again made me think about how our environments are created in a way that can exacerbate negative health impacts. And also when I was talking to a childcare facility and asked, well, my child want to play outside, it's by the road, and everybody was saying it's fine because there's a fence. There was not this connection between, yes, there is a fence, it's not maybe, going to run on the road, but they're going to be exposed to all the emissions. There was not this just connection between the particular kind of environment and health. So fast forward 12 years later, I continued doing this work, through health policies and health impact assessment, and actually was looking for childcare for my second child, and we were definitely more well financially positioned to afford a childcare and choose a childcare. So this is actually development in a very new affluent area in the area. And so you can see here, there is a childcare playground. It's an aerial image from Google. So thanks Google for allowing me to do that on crossroads. And as you can see here, this is very busy streets. And again, the playground is facing the street. But what was different for me this time, I had the choice because I had, my income was at a different level. I had the choice and I could choose something that was not kind of from an environmental standpoint. So that really, again, drives for me the messages that how some individuals can make those choices while others couldn't. And I was privileged to be able to choose a different daycare this time. And this is the image of my daycare that I chose for my son, that away from the road, very good green environment. And again, a testament that the importance of health policies, and importance thinking about how we're placing, facilities such as childcare, how they're positioned, and what some levers and the mechanisms and the policy that can help. And also the choice that people can make. Who can make choices? Like individual like me in the situation could make a choice with the daycare, but others might not be able to. So they would put in the daycare that the budget would allow. Because health policies spans all different strategies, from kind of informational, of convening the stakeholders about policies, to actually more like a formal of creating cross-sector collaboration and task forces, to actually integrating, health in policy decision making. There's so many opportunities and careers to work at those different levels and implement all those different opportunities. So what it meant for me personally in my work, trying to figure out how I can plug in through all of those different levels in different ways. And this is kind of 10+ timeline of not just my personal, but our institute where we were in that space. But I do think that as you're thinking about what you can do in your roles, considering different ways that you can implement that. And so for us, it was doing this health impact assessments to really demonstrate decision makers the connections between health, decisions, health and equity. And we specifically chose different topics that we can expose from different sectors, decision makers to this concept. So we did HIAs on medical marijuana, water use, kind of thinking about this water sector stakeholders, environmental health, casino development, transit, liquor licensing in grocery stores, and corporate farming. So my goal was really, and the goal of the Institute was to really help, Kansas legislature specifically, to really understand kind of that framework and how it can be applicable across the sectors. That's definitely an opportunity, I think, to think about how that can be used in your work. But then the other thing that we have done is, which I think is a very unique opportunity, as you're working with other on other projects or other funders, offering them an opportunity to include that kind of framework and what they do. So we were very fortunate in Kansas when Blue Cross Blue Shield of Kansas developed Pathways to a Healthy Kansas initiative. It was just genuinely addressing all the different areas. We offered them to include health and health policy as a part of that. And so they actually included in the framework of that bigger initiative a specific focus on health and health policies, and their initiative focused on 26 communities. So that allowed us to, under this project, to work with communities a little bit more on health and health policies at the county level, to introduce them to that concept, to introduce them, to offer them kind of a package of menu of options, what they can do. Like, do they want to develop a cross-sector task force? Do they want to do health lens analysis and help provide technical assistance around that? So if you do have, opportunities to be part of informing the design of the project or work with a funder developing design of the project, then be my opportunity to put this on the table and say, would something like that, be reasonable and try to do some experiments in that area. I think, of course, another piece there is evolving of creating kind of training resources and providing kind of this information to others. I think both Sandra and Julia talked about that. So I think lastly, I just want to touch on, in some of those things already been discussed, what HIP, health and policy focused careers look like. In my mind, it doesn't have to be just like a solid health and health policies role or like a job description that says you're like health and health policies, program officer. There can be an integration of this role in the already existing jobs. And so, I know public health institutes have different type of positions that kind of blend themselves really well, like a policy analyst. There can be that integration of health and health policies, health impact assessments in this work. There is the health coalitions now, when they're thinking about holistically of improving health, have elements of that. Health departments also are moving in the directions, and there can be part of that positions as well. So as I work in the health institutes and bring this idea, I mean, some health and health policies ways to do it is thinking about upstream factors. So like if you're doing research, think about how you look at social determinants of health impacts, how you really identify opportunities to or kind of policy system-wide changes, so not really focusing on individual or behavioral, really going that again, this upstream, really think about cross-sector collaboration. So a lot of health and health policies are, and Julia talked about that, is really bringing from other sectors together and thinking about how they can integrate, because they're the ones that making decisions that impact the health of the community. And a lot about community engagement and power sharing. So it's not just engaging community, but really power sharing with the community. So the actual decision making resides with them, and they help to drive the process. And so there is a kind of a list of other type of career or HIA related, I think, where HIA type of or health and policies type of activities can be integrated in those roles. I think, advocacy positions within their organizations, those who are responsible in health departments for community health needs assessment. I think that's a great opportunity to, engage those from cross sectors in that particular work. And if you're doing some other type of assessment to, again, integrate the principles of health policies. So I think there is definitely very, very wide opportunity there. And lastly, I just want to kind of circle back to the question is about what skills are helpful, and I will try not to repeat what my other colleagues already beautifully described, but I do think that a lot of soft skills are very important in this work, in addition to technical skills that both of them described, is having this active listening, even if you, with the community, absolutely very important, because that drives what issues you're focusing on, how you do the research, but also with elected officials, really having active listening, what the issues and what's that's driving them, what the importance are, so you can inform those processes based on that. I think self-reflection and continued learning as a field is very important. We can learn each other. I started my career from learning from others, and I continue learning every day. So being open to that will really kind of enhance that. I think emotional intelligence, how you read the room, and how to pivot necessary for constructive an effective conversation, and as well as conflict, management and resolution. When you convene a lot of people, Sandra and Julie talked about facilitation skills. You have to be able to read the room. You have to be able to know which example to pull from your sleeve. As I'm going to a lot of rural communities and talking about health law policies, I'm constantly thinking about, if I talk about nuisance abatement, would that issue align with what people are worried about? So it have to be reading the room and really thinking about how to use the information that makes the most sense. And adaptability and resilience, because policy process is so it changes all the time. There is a lot of things that you cannot know, that you just have to pivot. So being able to really adapt in the moment and figure out, and be resilient for all the positive or negative feedback that you can receive is kind of another skill on the soft side that can be really helpful. So I will pause there and give it back to Sandra or Cindy.
Yeah, thank you very much, everyone. Really appreciate your comments and reflections. We do have one question here to start us off. What do you think it takes, or what strategies have you employed to promote HiAP and help change the mindsets of stakeholders who might have knowledge of or any interest in HiAP, such as people in the government or private sector?
I'm happy to, this is Julia. I can speak to that a little bit, that when we first started this work in our California state government, there was a governor's executive order saying that all these agencies should participate in health and all policies. And so we were like, great, we're going to pull them all together. But none of those agencies had ever heard of this. None of them knew what this was. And we got a lot of resistance. Like, why should we participate? We don't have time. This isn't funded. Y'all are public health. We do this other thing. Like, this isn't our focus. Stay in your lane. It was really critical for us to learn about those other policy areas, to learn to have deep respect for them and their work, learn about their goals, not just make our assumptions, and understand what challenges they were up against and try to find these co-benefit areas. We talk about co-benefits a lot in this work, areas where we might do something, we might propose something that's health promoting, but is also going to help them achieve some other piece of their mission at the same time. So really, like, putting ourselves in the shoes of these other folks that were outside of the health realm was critical.
And just building on what Julia was saying too, some of it is awareness building, right? Like working with them and saying, you're already doing this work, right? Some of the things that you're doing already impact health, and helping them to see that they're already engaged in health. And then, like what Julia was saying, find out what their goals are and figure out how to make this, and this is the secret sauce, I think, how to make this not extra work, but how to make this something that enhances things that they're already doing, that helps them not just achieve their goals, but maybe provides an enhancement to things that they want to do, but don't have time or resources to do, right? Like, everybody has to have something that they're bringing away from the table, as well as something that they're putting on. Tatiana, I saw you unmute too.
Great. Well, love the question, and honestly continue to experiment and trying to figure out what works and learn from different trials. But we, in terms of specific strategies, definitely agree with both speakers. In some of our communities, we tried what's called data walk. It's a particular concept where you lay out in the big posters some data points with some narrative, and then let individuals interpret the data, walk around and have a discussion, and then have a facilitated discussion about what kind of leads to those health outcomes, what leads to those disparities. And when you have in a room is a mix of community members, elected officials, people from different sectors, and really kind of getting these conversations to impacts of systems and policies. So that strategy was used to start the level setting. And then after that, when we get to that policy question, like what policies, that helped to, there were a lot of aha moments. There's aha moments and people say, oh, we should look at our rental inspections. When we saw that the quality of housing was poor and there are some health outcomes related to that, led to the conversation, let's look at our policies on how we do about the rental inspections and how can we strengthen that policy. So to the point that my colleagues were making is, in that case, they already self-identified what the policy is. So it's not, just us coming them and suggesting something. And then what helpful to say, okay, let's look at the health and equity lens and then inform kind of your decision where to go next to that. So that was one of the strategy. I think the other one is when we are talking to communities about health policies, we let them pick what policies they're concerning to them. So we asked them what policies right now your county commission is discussing, or your city council, and where there is some, maybe different perspectives, and what information you can, generate or can be generated to help with those discussions. And so again, I think it's just like this, just in time information that's relevant to them, and really making it, I guess, less theoretical, more practical. As well. It never comes exactly as you plan. There is still some challenges, and because it's not like a kind of clear, cut and dry kind of topic, but it has been a good kind of conversation starter to get to the next level.
I could just add to one of the strategies we've used at different levels is using infographics. As sometimes, especially for the community, it's hard to throw a lot of tables and datas and long reports at them. But if you can condense it into sort of more bite-sized pieces of information with infographics, it helps both legislators and the community get a quicker grasp on some of the issues and concerns, and can help them then focus further on the discussion of what do we do next together. And they've got that baseline sort of at their fingertips a little bit easier. So any other strategies like that, using media or other ways to kind of get the information out there? Anybody used? No. Okay. Another question we had is, what do you think some of the future opportunities that you see in the field? Do you see further trends where people could use some of their skills and places where they could get into the field?
I'll start off. So this is the first time that I have ever seen HIA in federal legislation being even suggested as an activity. The Biden-Harris, the IRA, the Inflation Reduction Act money listed HIA as an eligible and encouraged activity in the money that's going to come down to communities. I think it's still rolling out, but that's going to be an enormous opportunity that's coming down the pike through some funding from the EPA. Is one of the bigger trends of opportunity that I see, because as that money rolls down to local governments, then they are going to be needing these skills and these kind of frameworks and tools to be able to do this work, to be able to take advantage.
Great. Where would people be watching for those opportunities to be listed, do you think?
The funding should be coming down to the states fairly soon. And we actually, I don't have the dates memorized, but this is the Inflation Reduction Act money. And there's also money that's coming behind that for environmental justice that'll be rolling down to states. So those jobs should be coming online in the next 6 months as that money rolls out.
Right, Julia or Tatiana, thoughts on where to look for those opportunities?
I think, yeah, just similarly, there's a lot of funding. I don't want to repeat what you just said, but there's just such a proliferation of new work on social determinants of health and health equity right now that's funded. And I think that part of it is you're not necessarily going to find things that are called HIA or called health and all policies. But you may find things that are around social determinants of health, social determinants of health and equity, health equity, intersectoral collaboration. There's going to be different kind of code words and keywords, and keep an eye out for those. And yeah, but I just think there's this is a good moment to be getting into this field of work.
Yeah, that's another what I have even recently saw. There's been a CDC kind of a funding opportunity for in public health space and the big infrastructure grants. And part of this work is focusing on kind of health and policies. So health departments that get funded will do some of the work related to health and policies. So it presents an opportunity if you are kind of engaged in that space to perhaps kind of provide some kind of technical assistance, or work with the health departments to provide technical assistance as well. And so I also again want to highlight public health institutes. Public health institutes have a variety of positions, and some of them, a lot of them do focus on specific to addressing different issues through that lens of going upstream, addressing social determinants and addressing equity. So the careers with that particular entities as well will be very beneficial. We are seeing increased participation of like insurers, like in Kansas, I mentioned Blue Cross Blue Shield of Kansas having a community-wide initiatives where they are thinking about population health and addressing that through kind of broader social determinants and equity lens. And so I'm imagining that hopefully that trend will continue and across different states. And so that will be an opportunity to apply those skills as well.
Thank you. Julia's going to have to get off in just a few minutes to moderate another session. Are there any other specific questions that you would like Julia to address while she's with us? Okay. I did see. Oh, go ahead.
I was wondering if I can ask Julia a question. So you talk about through kind of this racial justice, lens. What would you recommend for individuals that are interested in, bringing that to their current position, or even looking at opportunities that specific focus, how they can best position themselves to support that position and continue to develop that career path?
Yeah, thanks for asking that, Tatiana. I have a couple of thoughts on that. One of them is, if you are working inside of a public health agency or public health organization, it's going to be really critical to draw connections between racism and public health. And there's so many resources now on this. There's a national movement around declarations of racism as a public health crisis. The American Public Health Association has a lot of resources. There is a lot of published literature for people who, this is a no-brainer. We don't need more and more evidence. And for people who want that and need that, there is a lot of documentation, not just about the impact of racism on differential access to resources, like what you talked about, Tatiana. I thought your example around childcare facilities was an excellent one that is going to come down along lines of income, immigration status, race, and other factors. But there's lots of documentation also around the experience of racism itself and how that impacts people physiologically in terms of health. So I think it's important to learn that literature, be well versed in it, for one thing. And then the other thing that I would point folks to is an organization called the Government Alliance on Race and Equity, GARE. They are incredible. We partner with them very closely, and they are now just started this year, I think, where anybody can sign up to do trainings with them, and through that are virtual, online, and through those trainings you learn about the relationship between institutional and structural racism, government practices, impacts on community. And they've been building a national movement of government jurisdictions tackling institutional and structural racism. And one thing that I think has been really interesting as a public health person is that this is beyond public health, the GARE national movement, but a lot of jurisdictions that are involved in GARE are being organized by their local health departments. So not all of them, but there's a lot of health departments that are involved in that work. And if you are in any government institution, including public health, you can see if you can get your institution to sign up and become a member of that network. I'll drop a link into the chat, that resource.
Thank you. I know our local health department is very involved with that group, so thanks for mentioning that. There was a comment from Natasha about, she's in a state where there's little or no HIA education or implementation. Where would people go if they're interested in, getting more background on HIA or HIA-AP process?
SOPHIA has resources on our website at hiasociety.org. Kansas Health Institute has some really great resources. I know the State of Equity has their resources. Also, I don't know if you've looked at the National Association of County and City Health Officials. They have some really good resources and training, as well as if you're looking at the state level, ASTO, the Association of State and Territorial Health Officials. Did I miss anybody, Tatiana or Cindy?
No, really good resource. Near Rutgers occasionally will do like one-day intensive trainings on process. So it might be from other universities nearby as well. Julie,
Natasha has a hand.
Yeah, go ahead. Did you have, I think?
Yeah, sorry. I just wondered if it was possible to elaborate on that. I actually educate on HIA. The difficulty that I'm having is the legitimacy of getting the education out there in a state that's only done 4 HIAs, and there's no real cross-sector education on it. The university doesn't teach it. I'm just trying to think of the best way to have a legitimacy to get myself out there to educate people. That's what I'm actually having a struggle with, is a lot of people just ask me about return on investment. They want some kind of tangible product. They don't seem to care about the health implications, or they're only considering certain really limited aspects of health implications. They're not seeing the bigger picture of how health equity can benefit their projects. And so it's the educational aspect of it as a consultant and a population health strategist, getting people to employ me, at least, to educate on it. It's just really difficult here. I mean, I'm in Arkansas, so quite close to Tatiana, but yeah, we have just very limited information and education about HIA in general, and people don't seem to want to be directed to information or include it in policy making. So I'm at the beginning of trying to start educating at the state level, and I'm just finding it such a struggle.
One of the things that we did, because we had the same, issue when we started in Florida this was 2012, right? Like no one knew what HIA was. It was this thing that was done in Europe and in California. And, we're in Florida and we don't hold with anything European or Californian, right? And so we basically, I started having a monthly call. I called it something non-threatening, health in the built environment call, and marketed it first internally to the public health department, and getting especially our community health people and our environmental health people to start coming to these and just raising awareness. It took about 3 years, I think, before we were ready for everybody to feel like they kind of understood where we were going and what we were doing. But in the meantime, there were communities that were like, yeah, like, I'm on board, come down and let's do an HIA together, right? And started thinking about this more proactively. And then I created this kind of community of practice, right? With the people first, those who were willing to come along, and I would give them the platform of the statewide call to talk about their HIA or their community building or their project where they're trying to work with a particular set of stakeholders to build trust, and sort of talked about skill building. And eventually, right, like we were able to build some momentum. But I think the thing that really brought it together was we had a statewide HIA conference.
That's amazing. That will give me hope.
We did it with like zero money, right? Like, I mean, people paid for their own travel. We held it in the middle of the state. And because we had been able to build that buzz and that this is how this will help you. And the way that this will help you is we were able to use our HIAs to talk about money, right? Like a lot of people in their communities, they're like, oh yeah, daily average years saved. Like they didn't know what that meant. But if you talked about, okay, you're Volusia County commissioner and your share of Medicaid is going to go up unless you intervene in these ways in the built environment so that people can be more active and use active transportation and make the bus accessible, then you are going to save money. Right. I mean, this is the only way we could build the case for people to even be interested and come to our training. Tatiana, you're in a red state as well.
Yeah, just to add a little bit, I think definitely takes time. As I showed my timeline, it's been, since 2010. We're trying to do it. I think it's a multi-pronged approach. It's considered to be integrated in pretty much every conversation. And it's not just like, here's, one effort. What I found to be trying to do is, if I have conversations with a state agency, I bring it up, like as applicable to their process. If I talk to elected officials, I bring it up. Like I try to bring it up and try to show its applicability on all different, like in small bite pieces. You can think about, ask a question here, what about health? Or you can hear, maybe think about cross-sector task force, or you can look at you doing strategic planning, think about, are your strategies reflective of health policy principles? So it's just making that as a natural and organic process and just constantly doing it, over and over. I think the other piece is figuring out, is there something in your state or organization that will have interest in partnering around that? And kind of doing that is there is a way, a particular state agency or, foundation and like, can others kind of rally around that and do more joint effort and kind of carry that together with you? Probably where I would recommend. And if you do look at the policies, thinking about what policies you are choosing, and if there's individuals that might be resistant to that, there is a way to choose policy where people can genuinely feel like it can add value, and it's not as much polarizing.
Thank you both. That was really helpful.
Yeah, I think starting with policies that can appeal to both sides of the aisle will help, because at least you're not having to fight against one or the other. Yeah. And often health is, the health of your constituents is something everybody can support. So if you can frame it in a way that everybody can find a way to buy in, that can help move things along. Any other questions, folks? You can unmute or put it in the chat.
I have a question. How many of you have actually done an HIA or are thinking of doing an HIA maybe? I know at least, just give me a thumbs up if you've done one. I know at least one person on here has done one.
Yeah, Anna's saying she has. Natasha.
Great. So some folks have actually done it.
Jenny might be doing it in her MPH program. Tim has.
Great. So was there anything in your experience that we didn't bring up that's a skill or a knowledge set that you found through your experience of doing HIAs that we didn't talk about? Go ahead, Natasha, unmute yourself.
Yeah, one of the things that I discovered after doing the first one, which was a trail impact assessment, was that local entities, i.e. the public health department and planning, they just didn't talk to each other. This was where I had discovered this real lack of communication. So the universities weren't educating as an integrated course. It wasn't a multidisciplinary or interdisciplinary education area. Planning didn't consider health, and public health professionals weren't talking to local government. So I just felt like it was a very disconnected process. And that was my incentive, I guess, to further investigate health in all policies and health in local plans. So yeah, it was eye-opening.
Yeah, the first HIA that I did, I got a grant from ASTO, and we were looking at a proposed complete streets realignment of an intersection. And the community, it was the very first one ever done in Florida, and the community worked really hard on it. And whenever I went to a national conference to present it, somebody in the back of the room was like, well, I don't know why you did an HIA on that, right? Everybody knows Complete Streets is health promoting. And I'm like, well, the Daytona Beach City Commission didn't know, right? Like, so it's, where is the community that you're at? Things that may, seem intuitive to other people or not. Let's see, people were putting what theirs were on. Casino development. That's a cool one, Tatiana. Remember that one.
The interesting learning from that process was that other casinos in the area was very engaged in that, following that HIA and discussion, because they actually were concerned about also a new casino coming in because of the market share and sharing the market. So they were interested in taking the results from HIA and even, sharing them because of that kind of interest. So sometimes you don't know where you might find people that are going to align for different reasons, but be interested in your study.
Our first one was also transit related. The city council was looking at proposing either going to a light rail or expanding rapid bus service. And we looked at some health benefits of using one or the other format. So it was interesting. I think one tip I would give is to try and make it not too big of a scale on your first ones, just because there's so many things to consider. Let's see, Anna's got one looking at proposed bylaw change in the county that would permit the development of community gardens.
That's a good first one.
Yeah.
I consulted on one in Nevada where they were looking at requiring kindergarten, right? Before the HIA, they didn't, it was the Southern Nevada Health District that did it. And before the HIA, the state of Nevada did not require children to go to school before the age of 7. So another thing you would think would be, you know, just like, well, of course, you know, you want children to start school as early as possible and get their brains going, but it hadn't been presented to the legislature that way before. So that one was pretty cool. Go ahead, Anna, you can unmute.
Yes, I just did. So I wanted to mention an issue that I encountered with this HIA that I referred to in the chat on changing the policy to permit community gardens. And you're right, it was a good first one because we didn't get a huge amount of pushback. So it was a good way to kind of oil the wheels. There has not been an HIA since then, but one of the issues I wanted to mention, which is possibly specific to rural areas. I was working with a rural county health department, Yuma County, Southwest Arizona. I was supposed to be working with people in the public health department, in the county health department that had been assigned to this HIA, but they had been assigned to do this as an add-on to everything else that they were already doing. So what I found very quickly is that while they met with me and I had a great working relationship with the people in the county health department that were working with me, they basically couldn't do any more than just meet with me. So it became rather apparent sort of early on that I was going to have to put in most of the time that was required. Now it was funded, probably underfunded, you know, but at least there was some funding for it. I put in a lot of extra hours because of that issue. And so it really relates to the point I'm trying to make here is the capacity of existing agencies to do this kind of work can be difficult, especially in rural areas with very little funding for county health departments. To start with, and then expecting them to do this additional work is a big ask. So that was one of the big takeaways that I learned from this. And I was working with a network of people, other people doing other HIAs in the state of Arizona. And this was quite a few years back in 2015. It's kind of lost its momentum. I don't think there's money available right now through the state, but there was at that time. And all of us that were working in the rural areas encountered this same thing. So that's something I wanted to just mention.
I think that's a common challenge, right? And it's one of the ways that the public health institutes can be helpful. I know that you know, they often do underfunded projects. At least the one in Florida did. They were always helping out in communities. But I know, right? Like, I mean, this is the problem, that public health has been cut, right? And restaffing didn't take place in many places because of the coronavirus and the experience there. And people are just overwhelmed and they're tired at so many of these, especially the small health departments where it might just be an environmental health person and a public health nurse. So I think we have to make sure that we're building capacity, you know, as we're asking people to do these things. Yeah. Tatiana, what's your experience?
Yeah, that seems to be very, very similar to yours, Sandra. Absolutely.
You know, that might be one place where you could look to partner with a nearby academic institution that might be looking for a student experience where they could help do some of the legwork, research, you know, data gathering that might bear some time of the staff. So if you have some place nearby, that's, you know, we're always looking for opportunities, so it might be a good place to partner.
Yeah, that's a good point that you also mentioned, was that there was also, in addition to a time deficiency, there was also, you know, questionable capacity in terms of research itself. And HIA is a type of research. I mean, yes, you can engage a lot of different people, but it does require certain basic elements that are to do with research. The problem with us is that we don't have any academic institutions anywhere nearby. But it's not that that would be impossible. We can bring in people from Phoenix. We can bring in people from Tucson. They're both 3 hours away. So it's not exactly close, but it is possible. And that, you're absolutely right. That is the key, I think.
Well, thank you all. We're at time. We have just one other quick poll we'd like to put up, and then thank you for participating, and look forward to seeing you on some of our future webinars. So which of the skills in the HIA or HiAP do you think you need to develop the most? So we'll close with that, please. It looks like conducting policy review and analysis has the highest need. So thank you again for participating with us today, and appreciate input from Sandra and Julia and Tatiana, and look forward to seeing you on our next webinar.
Thanks, everybody.
Thanks all.